Hello, everyone. Good morning, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on dry skin condition. Dry skin condition is a condition which skin cells build up and it can cause the skin to lead feel rough, tight, flaky, and scaly. The location where these dry patches form vary from person to person. It's a common condition that affects people of all ages. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about our dry skin and psoriasis, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. B. Soorya is MBBS, MD, DVL Medical and Aesthetic Dermatologist. She has many years of experience in this field and is currently practicing at Erode, Tamil Nadu. A very warm welcome to you, ma'am. It's a pleasure to host you today. And
Thank you so
without further ado, let's dive into the topic of dry skin and psoriasis. First of all, I would like to ask you, what are the common causes of dry skin?
Dry skin, the commonest causes are it is external as well as internal. Internal hydration also matters. External, you may born with dry skin where there is a genetic factor is involved or because of your poor maintenance. So, your healthy lifestyle leads to a healthy skin. So, maintain a good lifestyle for having a healthy skin.
Right. Now, speaking about internal hydration, doctor, does drinking water help with dry skin?
Yeah, it does maintains your skin. Obviously it is very very important. Along with that you have to use a moisturizer, but internal hydration along with your lifestyle modification is very very important for maintaining your skin.
Right. Now, if you're talking about lifestyle modifications, doctor, what kind of lifestyle should one opt for in their regular day-to-day usual days?
You should have a healthy diet, well balanced diet where you have a healthy amount of proteins, carbohydrate, and fats, as well as avoiding junk food matters a lot, and drinking enough water, as we have discussed earlier, as well as going for a workout or exercise is as important as your diet.
Right. That's about the lifestyle. Now, doctor, tell us about external hydration also. Speaking about moisturizer, how often should one apply moisturizer?
It's actually twice daily. After you bath and come back, there is some hydration in your skin. After you towel dry your skin, apply immediately your moisturizer for your full hands and leg, depending upon your body parts, if needed or not, depending upon your extent of dry skin. And apply please twice daily after bath, or if you can't bath, just wash your hands and legs and apply moisturizer.
Right. So, doctor, are we saying that after bathing, the moisture which is there in our body it erodes? Is it like that? That instantly after bathing, within how long we should apply the moisturizer? We see a lot of people after bathing, they take a lot of time and then they apply the moisturizer. So, what is the time duration one should maintain in that case?
After your towel dry, after your bathing, after your towel dry, 2 to 3 minutes should be the gap, and then you have to apply moisturizer for better absorption.
Right, right. So moisturizer means applying moisturizer all over the body. We have a lot of people who will just apply moisturizer on their face and exclude the body. What is the way of applying moisturizer?
For face, it's necessary because your skincare routine will be cleanser, moisturizer, and sunscreen. So it is necessary for your face. But you have to apply on your neck also along with your face. That is a rule. When you apply for face, you have to apply for neck. Hands and feet, you have to apply regularly. For hands, legs also you have to apply regularly. For body part, depending upon the humidity of your area. If you are sweating a lot, don't apply on the body. You can apply in the evening time, once daily or if it's very hot or humid, you can avoid the body, but you have to keep applying on your hands and legs. If it is winter, you can apply for your body also.
Right. Now, doctor, when we are talking about moisturizer, does it has to be a body lotion or it can be any sort of oils? Does oils also do the work?
Oil do the work, but for normal skin, not for dry skin people. For dry skin, you have to apply moisturizer.
Right.
Moisturizer comes in creams, gels, lotion. Depending upon your severity and depending upon the climate, you have to select accordingly.
Right. Now, let's dive deep into the topic, doctor. Can dry skin, most of us, we tend to avoid dry skin. We are like, it's okay. We'll apply moisturizer, the skin, it will regain the moisture once again. But what if somebody is prolonging it, not applying moisturizer on a daily basis? What can dry skin lead to? Any other skin issues it can lead to?
Yeah, obviously, first will be premature aging on your face. You'll age faster. Your skin will age faster. Second, for your body, it can lead to lot of diseases, including psoriasis, xerosis, atopic dermatitis, and there are lot of issues that can come due to dry skin. So it's better to apply moisturizer regularly to prevent these skin disorders.
Right, right. We strictly are suggesting here not to skip your moisturizer and not to take your daily skincare lightly because it can lead to serious conditions. Doctor, does dry skin also indicate any other imbalance in our body?
Obviously, there are a lot. It indicates a lot of things. Dry skin may be due to hydration issues. It can be genetic. It can also reveal the internal disorders like kidney or liver disorders can present as a dry skin. So it's better try to apply moisturizer and correct it. If not possible, please consult your dermatologist and know your underlying disorder so you can correct it accordingly.
Right, right. Now, doctor, tell us about how common is dry skin associated with acne and atopic dermatitis?
It is mostly associated with atopic dermatitis. It's rarely associated with acne. Oily skin leads to acne. So it can patient also can have dry or combination skin, but it's mostly oily skin for acne. For atopic dermatitis, it's one of the important factor because your skin is dry. You get atopic dermatitis, and there since your skin is dry, you have itching, patches, rashes. Everything that occurs is due to dry skin. So it's directly proportional for atopic dermatitis.
Right. Now that is winters already in a lot of places, they have started facing winters. And this is the time when we actually need to take care of our skin, irrespective of the skin type. We need to take care of our skin. Applying moisturizer every day is very important. I have seen a lot of people in my life who has dry flaky skin. In general, they have dry flaky skin. So whenever they wear any dark color clothes, and when they try to remove the clothes from their body, we see flakes coming out from their skin. What can that be? Is that just dry skin or is it any other condition?
If there is mild flakiness or mild dryness, it's due to dry skin. But it's severe form. There are a
Hmm.
lot of disease like atopic dermatitis, psoriasis, and xerosis, eczemas can occur.
Right, right. So I have seen no matter how much ever moisturizer they apply on the skin after some time it comes back to the same old position. So in that case, we are talking about psoriasis here, doctor. How do we differentiate between psoriasis and atopic dermatitis and normal
See,
dry skin?
yeah, normal dry skin, you have just the skin will be dry, you can have mild itching. In case of
Mhm.
atopic dermatitis, your dryness will be severe and you'll have itching, mild rashes will be there. In psoriasis, it's a different scenario. You'll have symmetric red, scaly patches, red white patches symmetrically on your body, and it will be very itchy.
Mhm.
Itching can be less also for psoriasis. Itching may or may not be present in psoriasis, but the patches will be well defined. You can see some red patches will be seen all over your body, which will be scaly. When you rub it, the scales will fall off from that. So you can identify through that it is a psoriasis.
Right. Now, doctor, what can be the major cause behind psoriasis? Is it just dry skin that they have not taken care of the skin in the initial phase, or is it something else apart from that?
No, there are a lot of issues behind psoriasis. We have not concluded as of now what is the real cause, but there are
Mhm.
multiple theories like environmental factor comes into play, dry skin comes into play, where our immunity, autoimmune, it can be an autoimmune disease also where immunity is damaged, and like that a lot medicine induced it can occur due to medicines, diets, and many other things. But there are many theories, but we haven't come to a conclusion. There are no studies to come to conclude that this is the cause. But that affects psoriasis affects your immunity. So it affect your T cells. So it's a papilloscomas disorder. So it causes red patches on your skin.
Right. Now let's know a little bit more about psoriasis. Now, when it comes to any skin condition, doctor, we generally tend to become a little conscious, uh, provided that the person, we prefer not touching the person or being around the person. So tell us about psoriasis as well. Is it contagious somehow?
No, psoriasis is never contagious. Please do not treat the persons like that. Psoriasis is a treatable disease, and it is never contagious. It just have a red scaly patches that will go on treatment, and it will come back and go for many years, and then will disappear completely. It is not contagious. Rarely it spread within families, like less than 7% genetic transmission can occur. Other than that, it doesn't spread. Please don't keep that patients or give mental stress to that patients, please.
Right, right. Now, speaking about mental stress, we normally see patients who are suffering from psoriasis, they tend to be stressed most of the time. So it's not just the external healing that they require, they also need internal healing in such cases. So, yes, that would be a one serious suggestion for all the people who are watching this live now. Please, please don't make them feel left out. As doctor has already mentioned, it is not contagious. Now, doctor, moving into the next question, which is one serious question again. Can it be cured? Because we have heard a lot of people saying that psoriasis can be controlled but cannot be cured. Is that true, or is it just a myth?
It is true. It can be easily controlled by doctors, but it will be cured on its course. It can sometimes last for 5 years in a person, 2 years in a person. Sometimes it can last more than 10 years also in a person. But after a certain number of years, it gets cured on itself. But in that meantime, we can control the disease. Dermatologists can control the disease, but this disease will not
Mhm.
be lifelong for you. As it comes, it will go, but it may take times with exacerbation and remission.
Right. Let's now talk about the treatment options which are currently available to treat psoriasis, doctor. Also, how do we diagnose the patient when the patient initially comes to us, and the current treatment procedures which are available?
As a layman, it will be same. Multiple disorders can mimic psoriasis, so please don't self-diagnose. Come to a dermatologist. We'll diagnose the disorder on based on symptoms and signs. After that, depending upon the severity, we'll prescribe you medicine. We'll start with topical medicines. There'll be calcineurin inhibitors, topical antibiotic, topical steroids, salicylic acid, and multiple treatments are available. If you don't respond to topical treatment, oral treatments like oral antibiotic, oral antihistamines, and there are multiple immune modulating drug like methotrexate, cyclosporin, azothioprine can be given depending upon the severity. Please do not self-medicate. Please go to a dermatologist. First confirm whether it is psoriasis or not and get treatment accordingly.
Right. Now speaking of the treatment options, the topical options that you mentioned, doctor, we see patients, people nowadays. Everybody is a doctor because they have their own Google and they can Google things, from. They do that. Most of the people they do that, or they'll just visit the chemist and get a medication for themselves. So, how does that work in the case of psoriasis? Can it be suggested, or do we ask them to avoid it completely?
Please do avoid it. That's our suggestion. But since you go to chemists, they don't know whether it's psoriasis or not. So they'll probably give you a topical steroid, which will relieve you for some time, but again the lesion will come back. So please visit a dermatologist and have a proper diagnosis and treatment.
Right. Doctor, tell us, can these over the counter medications, say the oral medications that we are talking about, or the topical medications that we are talking about, can these also somehow lead to psoriasis?
Certain drugs can exacerbate psoriasis, but it's not the sole reason. Already you would have gotten the psoriasis, but certain drugs can exacerbate psoriasis depending upon the patients. So that's why we ask them to avoid medication. But certain painkillers, anti-hypertensive drugs can exacerbate your psoriasis. So please be mindful of that.
Right. Doctor, also tell us, can there be a genetic predisposition when we are talking about psoriasis? Is it possible somebody from the family is suffering from the condition and the offsprings also have a tendency of that? Is it possible?
Yeah, is it? It is possible. Certain studies have shown, but it's not very high, less than 7%. So it's very, very rare comparatively. You may get, but mostly you won't get. So
Hmm.
don't be afraid of that. Just be normal. This is a controllable and curable disease. So don't get so tensed if you get a psoriasis.
Right. So in such cases, is there any prevention one should take in or one can take in?
No, nothing. Just maintain your skin, apply a proper moisturizer, and have a good skincare routine and best lifestyle, best diet, and improve your hydration and your exercise. That's more than enough.
Right. Now, when we are talking about a good skincare routine, doctor, what does that include? What are the things that we must include in our daily skincare routine?
For your face, we have all been talking about this cleanser, moisturizer, and sunscreen. It's very very
Mm-hmm.
essential for your body. Depending
Mm-hmm.
upon your skin type, if you're using normal scope and your skin is fine, then leave it. If your skin is getting dry, get a dermatologist's opinion and change your soap or body wash, and accordingly and apply a moisturizer. If needed for body, if you are in sun exposing your body to sun, then apply a sunscreen for your body also, which is different from your face. These are the basic skincare
Right.
routine you can.
Right. Now, apart from the basic skincare routine, nowadays we see a lot of products which are available in the market. People use them widely. What about those products like vitamin C, say retinol, say hyaluronic acid, glycolic acid? Many products available in the market. Uh, how should one choose such products in case if they want to choose? And is it okay if they get it without any expert suggestion? Such products.
If you know your skin type, if that product suits you, then it's fine. But if you're not sure about your skin type, visit a dermatologist and learn from them which product will suit you more. Then get it. Please do not get everything that is available and use thousand creams. One cream will be enough for all of these things. But just consult and know your skin type before buying anything.
Right. Now let's talk about the topic once again, Dr. Psoriasis. What can make this condition go worst?
First is winter. The cold climate worsens psoriasis. We can't do anything about it. The second will be stress, which
Right.
we can control. It can be mental or physical. Please do
Hmm.
control. And the medications we have already discussed, like painkillers, a lot of painkillers, and certain antihypertensive medicine can exacerbate. And alcohol and smoking are known to exacerbate psoriasis. Do avoid that.
Right. So, yeah, avoiding stress we are talking about here, and a lot of us would not be able to, relate that how can stress play a role in this, but it does when it comes to our skin, our hair. Stress plays a major role, and most of us we tend to not understand this. We just keep on applying things after things externally, but that's not how it works. We need to control our stress. Doctor, one basic way how can one control their stress you would want to suggest to our viewers?
It can be mental or physical. Be mindful. Do know what you're doing. That's it. Just everything is temporary. It just comes and goes. Skin, hair, everything can be corrected if you have a good lifestyle. So be mindful and enjoy your life. Just don't stress out on a lot of things. Skin will be normal. Like psoriasis, after few many years, it will come to normal. So don't stress a lot. If you have already a lesion, if you are stressing, that will increase your lesion rather than reducing it. Just be calm, composed, and take the treatment properly, surely it will come under control.
Right. So yeah, staying away from stress is what we are suggesting our viewers today. And this won't just help you for your psoriasis or your skin condition or your hair condition. It can help you in many other way, because we know that stress is one thing which cannot be detected. It cannot be diagnosed, but it plays a very important role in your overall health. So getting rid of your stress, maybe walking out every day, can be one best way to get your stress out of your body. Meditation can be one excellent way to stay away from stress. Doctor, what about patients who are suffering from psoriasis and who are under medication? Do we suggest them workouts? Is it fine they are if they are doing workouts on their regular days?
Yeah, they can. It is not very normal. Psoriasis is not contagious. It doesn't spread to one another. So you can work out. You have a normal lifestyle. Just your skin lesions are there. But in
Mhm.
certain condition, certain people's, it's an autoimmune disease. So if you're not treated properly, or if your psoriasis is very severe, it may affect your joints. Those people, please ask your
Right.
physician about the opinion and do workout.
Right. Doctor, what about the sun? Can the like sunbathing, can it help the condition psoriasis?
Older days, there is a practice like sunbathing with cold tar application. It may reduce the lesions, but it's not the single mode of treatment. So, going on sun is very good for vitamin D. There are certain studies which has linked like vitamin D deficiency with psoriasis. So, if you have a good vitamin D, that's good for your body. So, on going on sun, it's good, but sun alone won't treat the psoriasis.
Right. Doctor, tell us a little bit more about psoriatic arthritis. What is this?
Psoriatic arthritis, I've already discussed. It's an autoimmune disease, psoriasis. So it will affect your immunity, thereby it will affect your joints, like rheumatoid arthritis or any other arthritis which we in an autoimmune basis. So it may affect your joints and can deform it. So it's better to get treatment as early as possible to prevent the deformation and other effects. But normally, it is very rare. Not every psoriasis patient get arthritis. Like 1 in 100 or 1 in 1,000 gets it, but if you do get it, please treat it as early as possible. It's not as deformatory
Right.
as rheumatoid arthritis, but it can lead to deformation.
Right, right. So people who are prolonging their condition, people who are seeing such changes in their skin or in their body and still prolonging the condition, this can be one serious condition. You should not prolong this condition at all. Visit your nearest expert as soon as possible. If not, please get yourself checked every 6 months. Very important. A full body checkup every 6 months. We suggest that to all our patients, all the viewers, please get yourself checked, because we do not know what is happening inside the body. And make sure you are doing that under an expert supervision. Do not be your own expert. Our experts are always there to help you out. They are always there around you. Make sure the chemist is not helping you for that, and make sure your relatives, your friends, your family, they are not the one who can help you out with that. Now, moving ahead towards the next topic, doctor. The organs that we were talking about initially, like earlier, regarding psoriatic arthritis, what organs does psoriasis affect majorly?
It can rarely affect your kidneys, lungs, liver, everything can be affected, but it's very, very rare. If you have not treated the properly, and there is a condition called erythrodermic psoriasis, which is the severest form. It's an emergency where your whole body will have rashes and there'll be scaling which will peel off regularly. There you have to get admitted and get it treated. If you don't get it treated properly, that can affect your whole body. Your organs can affect it and can lead to failure, and even worsen, it can worsen your condition and can lead to mortality also. So it's if your whole body has erythrodermic psoriasis, like rashes all your body, scales are peeling from full body, including eyes, face, everywhere, then it's better to get admitted immediately and get treated by the correct doctors.
Right. Uh, Moving ahead, doctor, tell us about your experience so far. What was the worst case scenario you saw? till date when the person was suffering from psoriasis, and how did you deal with it?
uh, it can be extreme. The person may have very small lesion and they can be very stressful. It will also
Right.
they may not have a lot of skin lesion, but their stress will be very low, very high. That can affect their quality of life, regular day to day life. That is one kind of
Hmm.
scenario. And the other will be like erythrodermic psoriasis, where the patient doesn't get treated until they are in ICU or something, where their condition is worsened, where it can affect their organ. So we can't do much about that at later stage. So I'd suggest that psoriasis is a controllable disease. We can control it as much as that will the lesions will never be seen outside. So please take treatment accordingly, consult a good dermatologist and take treatment accordingly as early as possible so your disease can be controlled, and within few years it will be cured by itself. So with that time, please control yourself. It can be extreme. Every patients are different.
Right, right. Well, I can see a few questions coming up from the viewers, Doctor. The first question comes from Pooja Sharma, who asks, "Can home remedies help psoriasis?"
No, please don't do that. Psoriasis will never go with remedy. It can instant like aloe vera or something. It's a moisturizer, right? It can instantly relieve your itching or lesions redness, but it doesn't help any more of that. So please consult a dermatologist and take treatment accordingly.
Right. The next question, Doctor, comes from Sona Sharma, asks, "Is it okay to take frequent baths?"
No, twice daily is more than enough. But if you are frequently taking bath, you're stripping the moisture from your skin. The natural moisture is also stripped off. So twice is more than enough, I think.
Right. The next question comes from Pooja Sharma, asks the same question again. "Can sunlight help improve psoriasis?"
As we have already discussed, sunlight may minutely improve psoriasis, but sunlight is not the only reason for treatment of psoriasis. Sunlight is good where vitamin D will improve. Keep your vitamin D level checked and take supplement if needed. So your psoriasis be controlled earlier.
Right. The next question comes from Ria Sathi, who asks, "Can Ayurveda or natural therapy help psoriasis?"
Since I'm an allopathic doctor, I can't comment on that. But a lot of patients says that it does work. If it worked for you, please go ahead. But consult a proper Ayurvedic doctors or the person who should be qualified about it.
Right. Now here, speaking about choosing your expert, I think that is one of the major role when we are dealing with any condition or any disease. I see a lot of people nowadays, they'll just visit the nearest salon because they offer such treatments nowadays. A lot of skin treatments, a lot of hair treatments they offer. So what do we have to talk about that, doctor? The salon, they have become our personal clinics nowadays. uh, should one opt for it, and how harmful can that be if it's not useful for us?
If you are talking about disease treatment, it's absolutely not no to salons. There are a lot of salons like hair care, and basic skincare. You can go for that. But you have a disease, and if you want a correction, please go to a dermatologist and get it corrected. Salon doesn't know. Salon persons are not qualified persons to treat your skin disease.
Right. So there is this obsession regarding the Korean glass skin nowadays. People, uh, I don't know what is this obsession, but people, they think that everybody can have this glass skin, and they are promoting it on the social media like anything. They will literally show you the changes, and we tend to fall for such traps. So visiting such salon, they will actually show you that they can peel off the upper layer of your skin, and then you will have a brighter skin, probably glowing like Korean people. Doctor, does that actually work? And what can be the negative effects, what can be the side effects of it if not?
First thing is we are not Korean, we are Indians. So our skin type is very different from Korean. So those skincare routine will may help you, but it doesn't give the same result for you. We get melasma, we get sun tanning, which they don't get because their skin type is very different. They need a moisture,
Right.
which is very different from ours, moisturizer. So keep your skin healthy, like externally as well as internally by your diet and hydration and exercise. That will keep your skin glowing. We should be happy with our own skin. Please don't run after Korean skins because we are Indian. Our skin type is very, very different. Please follow your
Right.
proper skincare routine and then your skin will glow on itself.
Right. Now, when we are talking about hydration for our skin, a lot of people would want to argue on that, saying that why just water? That can be any sort of hydration. That can be cold drinks. That can be any adulterated drinks. So, how does that work, doctor? Do we suggest them to have such adulterated drinks, or water just does the deal?
Water does the deal. Adulterated drinks and cool drinks have lot of sugars. It damages your skin. Please do not fall for that.
Mm-hmm.
Okay, water or fresh made juices in your home or buttermilk will be more than enough to keep your skin healthy. Please don't go for cool drinks or adulterated drinks which are full of sugar. That will damage your skin rather than
Right.
making it fine.
Now, right, right. Now, doctor, we have also heard that sugar can be one of the major reason why people are having breakouts or people are having damaged skin or um, weak hair, maybe. Does is sugar actually that harmful for our health and our skin,
It's
our hair?
very, very harmful. It is very, very harmful. As much as it's affect your health, it will affect your skin also. You will have premature aging, like as you have said, breakouts and dry skin. There are a lot of things which will
Mm.
happen to your skin and hair, as well as your nail, if you take a lot of sugars and junk foods.
Right, right. So speaking about my personal experience, I have cut out sugar since the past 4, 5 months, completely no sugar. So people who would want to ask, what are the alternatives for sugar? Doctor, what do you have to say on that? Any alternatives for sugar that you would want to suggest to our viewers today?
I don't believe in alternatives. I'll ask them to be mindful of the quantity which they take. We cannot control
Right.
everyone, right? Be mindful, take a lot of fruits, take a good diet, and hydration and exercise will
Mm.
keep uh, your skin healthy. But sugars, be very, very mindful. Keep very, very minimal because everyone cannot avoid it. And because if we say an alternative, if they take the alternative in larger amount, that will have a deteriorating effect. So
Right.
it's better be whichever form of sugar you take, keep it very very minimal because the insulin resistance
Mm.
which they lead to will be same almost for every form of sugar. If you take a fresh fruits in that form of natural sugar, it will be very good for you all.
Right, right. Now talking about fruits also, doctor, I was about to come to that. We normally tend to see people, they have this craving for sugar after their meals, maybe lunch, maybe dinner. So after the meals, they would look for any sugary things around them. Probably open the fridge instantly, looking for sugar. So in that case, we normally ask people to go for better alternatives, like dates can be one good alternative in a limited proportion, of course,
Yeah.
fruits. Now we also have heard doctors and experts suggesting us not to juice the fruit but have it raw. So what is the logic behind it, if you could please elaborate?
Yeah, raw fruits, the sugar absorption, the glucose absorption of your body is slow. When you juice it out, the sugar content increases. So the
Mhm.
glucose spike after you intake is very high. So it's better to take raw fruits rather than juices. So your sugar
Right.
level is maintained in your body.
Right. So people who are thinking that I'll just juice the fruits, the nutrients will go inside the body, but the formation of it changes once you juice it. That's not the right way, which is suggested. Try and chew your fruits while you are intaking them, the best way that anybody would suggest you. Now, doctor, speaking about diet, uh, we also have a similar question coming up from the next viewer. Deepak Saxena asks, what kind of diet helps with psoriasis?
A
Or any
healthy diet.
fruit or any food that can help the condition?
No particular foods or fruits has been identified in any studies or journals. It's just healthy diet and be mindful. Without stress is more than enough. Avoid junks, avoid sugars, and have a healthy diet. That is more than enough. There is no particular food that exacerbates psoriasis or reduces it.
Right, right. Now let's talk a little bit more about diet because you look the way you eat. आप जैसा खाते हैं वैसा आप दिखते हैं. We see people having good food. They have home cooked good food, avoiding junks. But the timing of having the food, it's very irregular. We see a lot of people doing fasting nowadays. Intermittent fasting is a thing, and it probably works for a lot of people. So, but we do not know the correct way of having the food. So, the timing of having your food, do we need to maintain it? How many meals should one opt for on a daily basis? If yes, what should be the proportion of having the right proportion of having the meals? If you could please also talk about that.
As we have already been following, 3 meals a day can be followed by everyone, but the
Mm-hmm,
quantity matters. What we eat matters. A
mm-hmm,
morning it should be a breakfast like a king. We have always heard about it. You should have protein,
right,
carbohydrate, and healthy fats in it. If you have, take enough
right,
protein. Actually calculate protein as like 1 mg per kg of your body. If you are 50, at least you have to take at least 50 grams of protein.
right,
Without that, you will have hunger, you will have cravings and everything of that. By evening, as a lot of studies are coming up, like finish your dinner as early as possible, like 6:30 to
right,
7:30, at least before 8, and keep a time of at least 2 hours before going to bed.
right. Uh, Now speaking about, let's go a little bit into hydration again, doctor. Uh, can detox water nowadays, people are also a lot into detox. We see that the society has been divided into two parts. One, who are always into junk, who are always influenced by the culture, the by the foreign culture, and one who are very very conscious regarding their health. So the consciousness, we see, has reached at such a peak that they they are the extremist. Anything they do, they will do at an extreme level. So let's talk about detox water, as we were talking about. Is it helpful? Can it make our skin better?
There are no studies to prove that. Detox water may not be helpful for everyone. It depends upon your
Mm,
underlying health issues and underlying skin disease. So be mindful of that. If you want to take a detox drink, please consult your dermatologist or your general physician before doing that. If your body is normal, if it accepts, it's fine. But not every detox will make your skin better.
right, right. So yes, towards the end, what we would suggest our viewers today is stick to your basic diet. जो आप बचपन से खाते आ रहे हैं, आप वही खाइए. Don't go for experimentations. Don't go for something which does not belong to your culture. People, we belong from different places. We have different food habits. We have different cultures. So everybody should stick to their diet. People from South, they are used to having South Indian food, dosa, idli, vada in the morning. People, we from Bengal, we have a habit of having protein rich diets. Or people here, they have a lot of oily food in the morning, but somehow it works for them because they have been doing it since their birth. So sticking to your basic home cooked food with minimal oil, minimal junk, and more protein rich and carbohydrate rich food can be extremely helpful for you. I think we should just stick to basic and not think much. That is what our expert today is also suggesting. Doctor, we had a wonderful wonderful discussion on the topic today. I believe it was helpful to all our viewers who are still watching us right now. Before we take a leave, any take home message for our viewers who has watched us so far?
I'd say skincare is not complicated. As you have said, for
Hmm.
diet, please stick to your routine. Just follow a proper cleanser, moisturizer, sunscreen routine, and a moisturizer for your body. If you have any skin issues, please consult a proper dermatologist who is qualified enough, rather than taking it from chemist or by DIY products.
Right. Well, that was the expert advice for today, and that was Dr. B. Soorya for us. Thank you so much, Doctor, once again for your valuable time. It has been a very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting dry skin condition. And in case if they get to see any such symptom, they now know that instead of self medication, it's always better to approach a nearby dermatologist. It was great to hear from you. And we look forward to many more such sessions in coming time with our viewers. Thank you so much, viewers, for excellent participation in today's session. To get latest updates on how to keep your skin healthy, do follow and like our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. You all stay safe. And thank you, everybody.
Thank you so much. Thank you for having me.